Okay, good morning. It is March 2nd, 2023. We are getting ready to broadcast live from Duke Spine Institute. Oh, really high. We're going to be doing the Duke laser disc repair surgery for 2 herniated discs. We're just numbing up the skin, and the patient has herniation at L4-5 and L3-4 that are causing pain. Hey, let's change the WAG a little bit on the lateral view. So you can see the needle. Before I start going towards our target, which is the herniation on the right side at L3-4 and L4-5, those are 2 targets. That's better. We want to make sure we have an accurate representation radiographically of the topography of the area that we're operating on, which is the spine. Shot? So what I asked Jordan to do was to adjust the angle of orientation between the fluoroscope, which we use to navigate, and the spine. And he did, and it's now in line. So we have accurate information. All right. So the question is, am I hitting the facet or the pelvis? It feels like pelvis to me. Let's get an AP. I may be too lateral. I may want to start a little bit more medial or aim a little bit more medial. Great job. You come out of there, please. To navigate, we must use 2 views, AP and lateral. Oh, well, it looks like I am hitting the facet. So her spine is actually deeper or farther forward than I expected. She's thin. She's got no fat on her body at all. Usually when people are heavier, their spine is further forward. But honestly, it doesn't matter. It's really just something you're born with anatomically. And in her case, her spine is forward in her body, which means I have to angle deeper. Shot? All right. Everything's okay. You're doing great. Get some more num-num. So we're going to use num-num. We call num-num. It's numbing medicine. It's a combination of Novocaine and Marcaine. And, lidocaine and Marcaine. And one is a short-acting and one is a longer-acting. We need the short-acting because the onset of action is right away. And we need the long-acting because it lasts. So that's why I use a combination. A lot of arthritis in the facet joint. You guys see that? All that sclerosis there. Just need to be a little bit more lateral. Shot. Trajectory is too high. That's why I'm repositioning. I'm aiming lower. Shot. Shot. All right. Is she awake and reliable?
Yep. She gave me the thumbs
Shot.
up.
How are you doing?
You doing okay? Hi. You all right?
At this point, you can see the tip of the needle is just about to enter the foramen. Show them that. Let's show you the neuroforamen. We call it the foramen for short. It's a hole or opening in the side of the spine where the nerves come out. Show us where the nerve runs out. You can actually almost see the nerve right there, the gray thing. You see it? No, further back. Further to the left. Right there. Circle that under the pedicle. Yep, right there. A little bit lower. You see it grayish? Yeah, that could be the nerve. It's hard to say, but you could see our entry point is below the nerve. This is what we call the exiting nerve root. In this case, at L4-5, it would be the L5 nerve root, specifically the right L5 nerve root. All right, that looks really good. Let's go back to a lateral view. We're making good progress. She comfortable?
You doing okay, my friend? Okay.
This is the delicate part when you enter the foramen, and now I'm at the back of the disc, right where the herniation is. She's lifting her head up. She doesn't like it. It's uncomfortable. That tells me this is painful for her. Yeah, she's moving around. So she went, before I was touching the herniated disc, she wasn't moving. Now that I'm touching the herniated disc, she doesn't like it. All right. So we're inside the first herniated disc, the L4-5. I chose the L4-5 to go first because I like to choose the bottom disc first. It sets my entry point on the skin. You need to set your entry point so that you can access more than one disc if you're treating more than one disc. So the hardest disc to get to is always going to be the first one you do. That sets the entry point. Then you try to get the other discs through the same entry point if you can. That's the idea behind why we do it this way. Shot? Now remember, she has two herniated discs that are both causing problems. So that's why we're going after two today. That's the L3-4 and the L4-5. Show us the L5-S1 disc. Sean? Yeah, perfect. Show us the L5-S1 disc. It's hard to see, folks, but see the white arrow there, Henry? Just circle the
Yes, we do.
disc. Circle it. There we go. Perfect. Yeah, so there is a disc down there, very hard to see. That's why you have to have an MRI. Use the MRI to help guide. And then show us the L4-5 disc, the first one, and then the L3-4. That is correct. Thank you. You can actually kind of see a herniation in the back of L3-4. You see it? Yeah, that's it. And that's on the right side, which is the side we're working on. All right. Blood pressure is good. Yeah. Any questions from our audience?
No current questions.
Sean? All right. You okay?
Thumbs up.
All right. She's reliable? Very good. So look at that. This is interesting. For those of you who watch these surgeries often like I do, you can actually see, look here, Henry. Look how deep these things are, right? How far in they are. Normally we see this in a really large patient, but because her spine is so far down in her abdomen that we had to go further to get to the disc. It just shows you the anatomical variation. We talk about this often. All right, so she has pain really in this area. Lay still, you're doing great. And it goes down into her right leg. Now, I looked at her MRI, and lo and behold, there were two disc herniations right here where she's having her pain. The first one was the L3-4, and the other one was the L4-5. Now, to get a disc herniation, you first have to have what's called an annular tear. Annular tear. And if you look at a disc, it has two parts looking top down. It's got a wall. Can you see this okay? A wall called the annulus fibrosus. Henry, you got to answer me. And it has a jelly center called the nucleus pulposus.
Yes, we see it. Apologies.
So when you get into an accident or have some type of trauma to your spine, it causes a tear in the wall, and then the nucleus pulposus, the jelly in the center, can now find its way out through the tear whenever you're bending or twisting or lifting and just doing regular activities. We call that a herniation, and that's where all of the back pain comes and all the leg pain, because the nerves running down the legs run right behind the disc past the herniation. So step one is annular tear, step two is herniation. We call it a herniated nucleus pulposus. All right. Is she comfy?
You doing okay? Yep, thumbs up.
All right.
So now
Any
you're gonna
pain?
answer us with a number.
No, you don't want to tell them. Any pain? Are you having any pain? Are you having any pain?
Say yes or no? Yes, where's your pain located?
Where are you having pain?
Back.
Are you having pain right now as you're laying here? What'd she say? A little? All right. How bad is that on a scale of 1 to 10?
What's the number? 10.
10. Is that where you typically get your back pain? There, you get it in that area?
Said yes.
All right, 10 out of 10 concordant at L3-4. All right, is it better now?
Is your back pain better now? Getting there, she said.
All right, getting there. How bad is that pain?
10.
Is that where you typically get pain? 10 over 10. So that you get to go to sleep now. When you wake up, we'll be done with your surgery, okay? But definitely both of those discs were causing your back pain. So it's a good thing we're fixing them. Well, what I could say about this is, number one, both of those discs that we thought were painful, causing her back pain, are causing her back pain. And both of them are causing what we call 10 over 10. So when we do a diagnostic test, like a discogram, we ask the patient, are they having pain during the injection phase? If the answer is yes, we ask them, is that your typical pain you get every day? Or is this some new pain we're creating just in the operating room? The answer was yes, it's my typical pain I get every day. We call it concordant. Then we ask the patient, well, on a scale of 1 to 10, 10 being the worst pain of your life, how bad did the pain get at its worst? And the answer for both discs was 10 out of 10. So now we're putting her to sleep, and once she's asleep, we're going to start the surgery, the real part of the surgery, which is the Duke laser disc repair. Now let's go ahead and show our audience, why do lumbar disc herniations cause, back pain to begin with? How does that happen?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Welcome back. We are just now placing what's called the retractor, which holds the tissues open so I can do the surgery. It has a name. It's called the tubular retractor or endoscopic tubular retractor. And, well, just do a little more. And it's in, I think, really good position. So now we take the dilator out. We're left with the tube. You all see this tube here?
Yes, we do.
So the whole surgery will be done through this tube. We're going to finish this disc with the laser repair, and then we'll take the tube out and we'll place it into the next disc. All right. I know you have a question, so let's take the question.
We have a question from Canes25 on YouTube saying, Doc, if an EMG shows no radiculopathy, can you still have pain in your arms from cervical?
From what was the last word? From Searle?
Cervical.
Yeah. So, great question, Haynes25. I hope you're listening because there is an answer. Here's the important answer you have to understand. There's several considerations. Number one, EMG nerve conduction study tests are very much dependent on the technician doing it. In other words, if it's not done properly, you will not see the answer, the radiculopathy, okay? Number two, there are thresholds that are set for each EMG test. Every single operator, which is the doctor basically, they all use different thresholds. There is no standardization. And what that means is it's very complicated, but let's pretend you are at an active volcano in Hawaii and you have a volcano detecting device. And it's an older device, but it can pick up on rumblings and tumblings underground, and its predictability of volcano eruption is okay, 50% accuracy. And then somebody comes along with a newer device that's better. It, uses LiDAR and combines LiDAR with ultrasound. I don't know. I'm just saying it. Well, now the new device is more sensitive and it's going to pick up. So my point is, all the machines out there that are used are different sensitivities. Many of them are garbage. And there's a lot of garbage operators, like doctors that are not qualified to do EMGs, doctors that have bias or have ulterior motives, okay? And so the results of the EMG are operator dependent and machine dependent. And you should not be discouraged. I have a feeling that it was not done properly, but let's pretend for a moment that there is radiculopathy. You have to have 20% damage to your nerve before it's picked up on by that machine. 20% under normal good circumstances. So forget about the operator error, forget about the machine error. Let's say you have the perfect machine and you have the perfect doctor doing the test. You have to have 20% or more damage to your nerve before the machine will pick up on it, okay? Don't ask me why, but that's standard. Now, let's pretend that you do have arm pain and it's coming from the nerve there. Okay? The radiculopathy is basically a physiological dysfunction of the nerve root. And it occurs most commonly from pressure on the nerve root, pressure from spinal stenosis. That's what's causing it, spinal stenosis. So if you do have radiculopathy, it's greater than 20%, it's from spinal stenosis, which we expect it would be, then the machine could pick up on it if it's done properly. But here's the kicker. Arm symptoms like pain in your arm are not coming from radiculopathy. They come from radiculitis, which is actually inflammation of the nerve root, not damage to the nerve root. It's inflammation of the nerve root, which comes from the herniated disc. You just watched my video. Do you, Henry, have the cervical, what causes neck pain video?
Of course.
Would you run that so that Heinz can see it? Basically, what you're going to see in this video is that inflammation, and again, these are things that Duke Spine discovered. We discovered it here. I discovered it. And so we've made these videos to help people understand. But basically, everything okay?
Yep.
Basically, the inflammation in the annular tear spreads to the nerve root, causing radiculitis. The radiculitis is what causes your arm pain. The doctors won't pick up on it for many reasons, but in the end, you're going to be left to suffer unless you come somewhere like Duke Spine Institute, where we can diagnose the source of your pain at its cause, at its source, and we can treat it properly. That's why we broadcast, folks. We want to educate you, but we also want you to understand you can't just go anywhere and get great medical care in this country. Sorry, it doesn't work that way. You have to go to the right place. And I can tell you right now, 95% of doctors that treat back and neck pain, they just don't know how to treat it properly or diagnose it properly. So patients are unfortunately being told, hey, there's nothing wrong, you don't need treatment, just live with it, when they shouldn't be told that. What are we seeing here? We're seeing here herniated disc. The blue stuff is degenerated disc. Go ahead and run that cervical video for the benefit of the viewers so they can understand what I'm talking about.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.dukespine.com.
All right, welcome back. We're just talking business here, Luis and I. Once again, we are inside the herniation. For those of you who are wondering what's going on here, that blue thing, that laser, is a laser fiber. It is delivering at the tip energy, okay? And it's releasing at the tip, the very glass tip, it's releasing laser energy into the disc herniation. The blue stuff is the herniation. The white stuff is the annular tear. I'll try to orient you as we see things. But basically, I am pumping laser energy into the herniation, destroying the herniation, vaporizing it. Look at all that scar tissue right there, okay? Lots of scar tissue from inflammation. This patient has injured her discs, and now over time, the inflammation that you saw in the video has spread to other parts of the disc, causing more damage to the disc. We call that degenerative disc disease. All right, any other questions so far?
No current questions. Just a comment from Canes25 saying, thank you kindly for your answer. Explains a lot.
You're welcome. That's why we're here, to teach. Speaking of teaching, I was at the medical school yesterday teaching. Some people say to me, you should go to the university medical school and become a professor. Well, I am already. I've aligned myself with the University of Central Florida Medical School. I've been a faculty there for years. They are a new medical school. You don't see too many new medical schools in the world, at least not in the United States. It's rare for a new medical school to pop up.
There are 2 in Florida.
There's more than 2 in Florida. Oh, 2 new ones. Yeah. Yes, you're correct. You're correct. So many years ago, 20 years ago, Orlando decided they wanted to have their own medical school. And they hired Dr. Deborah German. She's the dean. They hired her to basically start the medical school. And she hired me as a neurosurgery faculty, but at the time they did not have a neurosurgery department, and they still don't. So to get a neurosurgery department, neurosurgery is the hardest specialty to develop. It requires the most sophisticated equipment, training, staff, residents, everything, faculty. Very hard to build a neurosurgery program. Anyway, we're in discussions now about how we can make that happen in Orlando. I think Orlando has the potential to be a great medical center for the school, the medical school. But they're competing against two of the biggest hospital systems in the United States and hence the world. Orlando Health and Adventist. Both of them, if you look up the top 10 grossing hospitals in the United States that make the most revenue in the billions and billions of dollars, these two hospital systems are in there. Orlando Health and Adventist. And they're ranked something like, I don't know, 6th and 10th biggest hospital in terms of revenue. Point is, how does a new medical school work with them, and where do they fit in? So that's really been something that I'm not interested in at all, the politics, but that's pretty much the basis for why Orlando doesn't have a neurosurgery program or other major programs like cardiovascular surgery and other types, is because there's too much, let's just say, fighting going on between. So right now the medical students are going out to hospitals in Florida in different areas to be trained, to learn. And for example, Duke Spine Institute, they're coming here for training, and we are offering anesthesia, but it's not a residency. These are just medical students that want to spend some time in getting additional training in the community with specialists like anesthesiologists. So we're.
Some medical schools, anesthesia is mandatory, you have to do 6 weeks.
Oh no, they have to. Yeah, I'm sorry, but they go to these other hospitals to do it, like North Florida. You know, for example, up in Gainesville. So North Florida is in Gainesville. And that's where one of their biggest programs are, is North Florida. Again, remember, they can't go to a Orlando Health Hospital. They can't go to an Adventist hospital. Right? Because that's the quote-unquote competition. So anyway, I'm not interested in the politics of medicine. I just think politics keep things from happening. That's my opinion on it. But look at all the scar tissue that's bleeding, you know. We've gotten rid of probably 70% of the herniation at this point on the right side. We have a little bit more to do, and then we'll be done. I think less than 5 minutes.
We have a few questions.
Yes, I'm happy to take the questions.
This first one comes from Diver X on Facebook.
Hi,
And
DiverX on Facebook. Welcome
They-
to our live stream.
they asked, after removing the damaged tissues, what would be your implant? Metal or any?
Oh, Diver. Hey, thanks for joining us. I'm going to assume you're a diver. Let me ask you a question, DiverX. I assume you're a scuba diver. Am I correct?
No current comment at the moment, but I will let you know if he does.
Well, it seems. Is there a scuba diving picture on DiverX's profile or avatar?
I think so. It is black and white, but it's a
All
little...
right.
Yeah, yes, he is.
All right. So DiverX, I'm going to propose something to you. I'm also a scuba diver. I'm advanced scuba diver, PADI trained. I've logged 1,000 dives, but they're all recreational dives, nothing work related. But long story short, you and I both know what scuba gear is, right? Metal tanks, whatever, fiberglass tanks, aluminum tanks, gear, right? So you got all this gear you got to wear to go scuba diving. You got all this metal. Imagine if there was a new technology that allowed you to not use any gear, but just that your lungs could breathe the air out of salt water, just like the fish do. That's what this is. This is the most advanced, latest technology in the world. You know, remember when nitrox came out, it was big and hot and it allowed you to go deeper and longer without problems. Anyway, this is far more advanced. This is like having the ability to breathe air out of water with your own lungs and not have to wear any equipment. We don't put any metal in. It's not necessary. It isn't necessary at all. It is no longer necessary. But a lot of surgeons still do it because they make a lot of money doing it. They make far more money doing fusions and metal, artificial disc surgery, than they do with laser surgery. So there's a financial incentive to keep going, right? Imagine all the companies that manufacture scuba diving gear. Masks, snorkels, regulators, BCs, tanks. Do you think that they're going to be happy that there's a new way to dive without any gear at all? That's exactly what I'm dealing with. We've discovered the way to scuba dive as long as you want, permanently scuba diving as much as you want, with no restrictions at all. Just like a fish. That's what we have. That's this technology. That's why we broadcast it, so people can actually see it. All right, we're done. Man, there was a lot of scar tissue here. That's the nerve root right there, underneath that. And you can see all the scar tissue and inflammation that was on the nerve root. No wonder why she was in so much pain. So we're basically now doing surgery of the spine without metal and without implants. There's no need. So if you've been told you need a fusion, or you've been told you need a laminectomy or an artificial disc, you don't need any of those things. You come to Duke Spine and we will fix you without metal.
We have another question.
Yes.
This comes from Sean Wilson on YouTube.
All right.
And they ask, what is the best insurance to get to be covered for your laser treatment?
What is the best insurance to get to be covered for your laser treatment?
Correct.
Great question. So if you're going to pick insurance, I would go with one of the bigger companies. You want to get a PPO plan, which has what are called out-of-network benefits, because our surgery center is out-of-network. And because it's out-of-network, we don't have a contract with any of the insurance companies. All right? But we can make contracts with them on a case-by-case basis. Or we can do the surgery and bill them and hope they pay. If they don't pay, then we're going to have to appeal and fight them to get them to pay. You are the patient with our help. So the best thing we could do is have a contract with an insurance company. We've tried, but insurance companies don't want contracts with good doctors, because that means there'll be what's called more utilization. More utilization.
Thank you.
Utilization is essentially where patients go and get medical care. You see, the insurance companies have for years been trying to keep people from getting medical care. And the way they do that, there's many ways, but one of the ways is to add what are called copays, where you actually have to pay every time you go to the doctor. The insurance companies discovered back in the 60s and 70s that if the patient had to pay $5 to go see a doctor, that they were less likely to go see a doctor. That's the basis and origin of copays. Insurance used to cover everything. There were no copays. There were no deductibles. There was no co-insurance. If you had insurance, you went to the doctor recommended surgery, everything was paid by the insurance company. But then the insurance companies decided, okay, well, we don't want people going to the doctor. How do we discourage them without actually saying no? And the answer was create a copay. So back in the early 80s, my dad was a doctor, and the first copays came. And it was $5. And it was just one insurance company. And the patients absolutely hated it. They were revolting against it. But guess what? That didn't change anything. Nope. That didn't change anything. The insurance companies don't care. So not only did they all start doing $5 copays, but they started to raise those copays over the years. And now That was in the 80s. Now the copays are not $5, not $10 anymore, not $20 anymore. They're $80, $90. As a matter of fact, the copay to go see the doctor is so high now for patients that the doctors don't get anything from the insurance company. The patient's paying for everything. You know, we get $90 and that's it for the office visit. Doesn't matter if we charge $600. Okay? So, next came deductibles. All right? Deductibles were their next creation to decrease utilization. A deductible is on top of your copay. If you go see the doctor, you have a copay. If you get an MRI, you have a deductible. And your MRI deductible may be $500 a year or $1,000 a year. That means you're paying the first $500. So over the last 30 or 40 years, you guys, you insured people, have been like little sheep being led for the slaughter. And then you come to me and say, oh, what insurance can we get so that you take it? The problem is your own insurance right now should be covering it. You've just got to make them cover it. And the reality is that the insurance companies are going to keep cutting your benefits because they don't want you utilizing health care. The more you go to the doctor, the more they pay. The more they pay, the less profit they make at the end of the year. Okay? So the insurance companies don't want you to have the best care because the best care means that people are going to use it more. They're going to go for it rather than say no. I'll give you an example. Fusions. We know the insurance companies cover fusions. At least they're cutting back now, but for various reasons I won't go into. But the insurance companies know that 10 people recommended for a spine fusion, only one of them will get it done. 10%. You know why? Because people are afraid of fusion. They're afraid to get it done. They've heard the horror stories. So the insurance companies pay for fusions, even though there's horror stories galore. Scratch your head on that one. So the utilization goes down, right? That's the point.
Yes.
People don't do it. And guess what? The insurance companies didn't have to say no. They look like angels. Oh, we'll pay for your fusion. Oh, I don't want a fusion. That's right. You think the insurance companies are stupid? They have the smartest people in the country, psychiatrists, psychologists. They know exactly what you're going to do before you do it. You think Facebook knows you? You think TikTok knows you? They're nothing compared to the data the insurance companies have. They can predict every healthcare move you're going to make. And they don't want you having a surgery available that you're going to actually want to do, like Duke laser disc repair. They're not stupid, and we're not stupid at Duke Spine. We figured this out many years ago because we were scratching our heads the same reason. Like, why would such a great surgery not be like blessed? Like the Pope himself showed up on a mule at Duke Spine saying, thank you. You are doing great things for people. That's what should be happening, but that's not what happens. The insurance companies, we've tried contracting with them. They don't want to even talk to us. Why? Because they know what's going to happen once they sign us up. Everybody is going to come to Duke Spine and get surgery. And they don't want that because they don't want to be paying those bills. So, I say this all the time. People don't get it. They're like, I don't understand. Well, this is why. Okay? It's the harsh reality of life. Your insurance company is not your friend. And there are no insurance companies that are your friend out there. And it's not just for Duke laser disc repair, folks. They're denying all new technologies. There's lots of new technology out there they won't pay for. Okay? So they say it's investigational. But here's the thing. Most surgeons will just accept that. And they'll say, well, what will you pay for? Fusion? Okay, then I'll recommend fusion. That's not how we are at Duke Spine. We're going to recommend the best treatment for the patient, not the best treatment for the insurance company. Now, somebody may argue and say, well, how is the Duke laser disc repair the best treatment for me when I can't afford it? Great question. The best medical treatment is not necessarily the best financial treatment. And that's where you have to understand the difference. Okay? We're not going to recommend to you what's financially best for you, what's the lowest out-of-pocket expense for you. We're going to recommend what's the safest surgery. What's the surgery that's going to give you the very best results? What's the surgery that's going to get you back to a normal life quickly? That is the Duke laser disc repair, hands down, every single time. Never fusion, never artificial disc, never laminectomy, never discectomy. Never. Literally, this is so much better. How do I know? Because I've done all those surgeries thousands of times. And I know exactly how they work, and I've seen the results of other surgeons doing them. And I actually have the best results of doing alternative surgeries, but those results are still nothing compared to this. They're much worse. So, what's happening with insurance? Here's what you need to do, folks. We have two options. Number one, pay your deposit and get the surgery done. We're going to bill your insurance. We're going to go after them. If they don't pay, we are literally going to go after them by doing appeals and then eventually filing a lawsuit. We have literally hundreds and hundreds of patients, and we're getting ready to file our first class action lawsuit in the next 12 months. It's going to be in the news. You're going to see, 283 patients file class action lawsuit against, I won't tell you the name of the insurance company yet, but it's a big one. And then we're going to basically spend 2 years or 3 years battling them and proving this is the better surgery for people and hopefully winning. Hopefully. But the insurance companies hold all the cards. Okay? They are master poker players. And they control politicians. They control the law. They write the laws for this country. And they've written the laws that favor them and really go against people and doctors and hospitals. So, yeah, we're doing our best. The other option is to get a recommendation for this surgery from us. We submit for authorization, they deny it, and then we will fight them again as a class action. So you're either going to pay your deposit up front and get your surgery now, or you're going to just be on a waiting list for us to call if we win the lawsuit, which hopefully we will. That's the truth. Now, are there insurance companies that cover this? Absolutely. We've had Blue Cross Blue Shield. They just got a check last week. I posted that for you guys on the live stream. You guys, for those of you who watched the live stream, I think it was last week or a week before, I actually showed you the check without the patient's name, of course. But the point is, we've been paid 100% of the bill by Blue Cross in the past. We've been paid less than 100% of the bill. We've been paid by Cigna, United Healthcare, Aetna, Blue Cross. We have a lot of workman's comp like Sedgwick and other insurers, AIG, they all pay, okay? But it's on a case-by-case basis because we don't have a contract. So we never know, are we going to get paid or not, unless we have a written agreement up front. We just got a call from Blue Cross Blue Shield of California. They want to do a case contract where they cover the surgery for somebody from California for one surgery, okay? Well, but we're negotiating. It's all good, that they're trying, but let's see if they agree to pay what we need to be paid. Okay? But the point is we're making progress, and if your spine is important to you, if your back is important to you, then you pay and get it fixed. I did the same thing. I went to see my ENT doctor, and I needed sinus surgery. My insurance said it's experimental. Experimental.
That's been so successful that I'm
Yeah, I know. Anyway, they said they weren't going to pay. So what did I do? I wrote a freaking check. Okay? I wrote a check. And I have no regrets because I'm very happy that I got a great surgery and I didn't die from my surgery. I didn't go to the ICU with complications. I didn't have a bad outcome. Okay? So you have to decide how important your health is. You have to decide how important your health is to you, to your family, to your kids, to your wife. And if you decide that you're worth it, then you come and you pay the deposit and you get your surgery done and you stand with us to fight the insurance companies to get them to pay for it. And if you do that, great things will happen, not just to you, but for everybody. Because once you start winning against the insurance companies in court, then they have to start covering the surgery. And that's exactly what happened with artificial disc surgery. In the beginning, in the early 2002, 2003, 2004, they would not pay for artificial discs. They refused. They called it experimental. So people paid out of pocket. They got it done because they didn't want fusions. And guess what? They took them to court and they won. And now all the insurance companies pay for artificial discs. You didn't know that? It's so strange people don't know this stuff. It's so common knowledge. To me, it's common knowledge. Maybe it's just not common to everybody else.
But I find it interesting that you had, quote, experimental surgery, you recovered so well, so safely, did so
Yeah.
great, and it was deemed experimental.
You could pick whatever procedure you want. You could pick tooth extraction for cavity, and the insurance company will say it's experimental. Of course, because they're going to say the cavity is not bad enough. Therefore, the indication doesn't exist. Therefore, the procedure is experimental. Not because the procedure is experimental, but because the indication for the procedure is experimental. In other words, they're changing the indications. They're basically practicing medicine. And they're going to tell you, well, we're not practicing medicine. We just won't pay for it. But it's the same thing. You know, they're saying it's not necessary. They're basically doing everything just short of doing the surgery. So insurance companies are not your friend, no matter who they are. They almost always try to get out of paying because it's financially beneficial to them not to pay. But this surgery right here you're watching today, this right here, is being paid by insurance. Okay? Because we did an agreement. We wrote a letter. It was 3 pages. It says this is how much the surgery will cost. We expect you to pay this amount, and we want to be paid within 45 days. And they agreed. They signed off. So now we have a contract for this surgery. You see? That's how you do it. So if your insurance is so good, then go get a contract. Long explanation, but needed. What's next?
No current questions, but we do have a couple of comments. This next comment comes from Diver X once more on Facebook. And they said, I got a herniated disc way back in 2006 and got a laminectomy on my L4-5. Few years was all fine after the procedure, and now pain is getting back. I was told metal plants would be needed. I'll send you my my latest MRI taken. I'd love to hear or have any recommendations from you. Got no work limitations so far as my pain tolerance is high, but I'm really looking for a solution.
Yeah, Diver X, let me answer your question. So you're like the last 10,000 people I saw. You're identical. You had a laminectomy. Very bad surgery. I used to do them. I did them for years, but then I realized that people kept coming back afterwards with more problems. So then I started doing laminectomy with fusion. And guess what? People didn't come back anymore. That was it, one and done. They were happy, they didn't come back. And that's what I wanted. I want people to be happy, get rid of their symptoms 100%, and never come back for more treatment. That's my goal. That should be every doctor's goal for their patient. But then I learned the laser surgery, and I realized that with this surgery, you don't have to do a laminectomy in the first place, because the laminectomy is bad. It destroys your spine. It literally destroys your spine. And it makes it so you need more surgery in the future. That's why these surgeons are doing laminectomy, because they're doing a minor procedure at first, which they know for sure you're going to be back again. And you're going to be in a lot of pain down the road. So basically, they've created a situation by doing your laminectomy. They know you'll be back begging for a fusion someday. And they've got you right where they want you, okay? I don't even know how to explain it. I don't even know if there's some analogy I can draw in the diving world. I guess the only analogy is this. Check this out. You've got a tank of air, you're gonna dive, and you need to go to 500 feet, let's just say. They know that you're gonna run out of air at 300 feet. So they've got a bottle of air at 300 feet waiting for you, but it's gonna cost you $10,000 for that bottle. That's what they're doing. They know that you're gonna run out of air, and they know that you have no option but to take that bottle for $10,000. That's what's happening in spine. And that's why I'm trying to explain it to people with my Spine Scams Exposed. If you go to my YouTube video, you'll see me talk about these things. All right? So the best thing people can do is avoid laminectomy, avoid discectomy, avoid fusion, avoid artificial disc, because all those surgeries are just annuity plans for the surgeon to get more money out of you, and pain management doctors too. Okay? I'm sorry you have to hear the truth from me, and it's nasty, it's ugly, it doesn't make you feel good, but it is the truth, and I only speak the truth. And frankly, if you don't believe me, I don't give a shit. That's my attitude. I'm sorry, but I'm not here to make you believe me. I'm here to give you the facts, and if you believe it, great. If you don't, go on and live in the matrix all your life and just be a victim, be a battery, a human battery for the spine surgeons and the hospitals and the implant companies, okay? But it's just like the matrix. I'm giving you the opportunity. Actually, let me have the grabber one more time. I'm giving you the opportunity to know the truth and to do something about it. Whether you choose to do something about it is your choice. Okay? If you watch The Matrix, it's a great series. You have to watch it. It's basically my second favorite movie series after Star Wars, the original Star Wars. And it really highlights how people live today. You know, basically they live in this delusional world of fabricated truth when the real world of real truth is actually out there. But people don't want to believe it because it hurts their egos, it hurts their whatever, pride. But the sooner you start to accept the truth, the sooner you can adapt to the truth and improve the quality of your life. And I'm telling you right now, these insurance companies are destroying lives, and the doctors are going along with it because they're making money. But what the doctors don't know and the hospitals don't know, they're too stupid to see it, is that there's a stranglehold on them by the insurance company. Is it on? I'm hitting it. Oh. There's a stranglehold by the insurance companies, and the insurance companies are calling more and more surgeries experimental that they used to not call. So they're cutting off this surgeries gradually, which I think is good for the patients ultimately, avoiding those kind of surgeries, but it's also bad because the insurance companies aren't giving patients an alternative that works. This is the alternative that works, and we have to fight to prove that. All right, any other questions? Just about done.
No current questions, but we do have a couple comments. This next comment comes from Sean Wilson on YouTube, and he says, "Let's create Duke Insurance."
Yeah, Duke Insurance would be great. So you pay $10 a month, and after 2 months, $20, you get a $30,000 surgery, right? Who's the guy who loses there? Think about that. Unfortunately, you're right. I would love to do insurance, but only because I believe people should get medically necessary care they need. But if I did spine insurance, which I've thought about, by the way, trying to help people, I would basically be paying my own money for people to get their surgeries. I just can't do that. So we've actually thought of things. So just so you all know, I'm always trying to figure out ways to help people get the surgery without having to pay for it. One of them would be a foundation. There are a lot of rich people out there like Bill Gates and Elon Musk. They got more money than they know what to do with in their lifetime. This is a very, very good way to spend your money to help people. They all have charities, you know, but their charities for the most part are bullshit charities. All these millions they donate to these charities mostly get wasted. Huh? Yeah, they've got some ulterior motive that benefits them, which is disgusting. You know, how much money is enough for you and your family? I mean, once you hit $1 billion, what are you going to do? Yeah, $2 billion? How is $2 billion any different than $1 billion? You're not spending it in your lifetime. You're not spending it. What's the point? Help some other people out. I mean, if one of these people, one of these Bill Gates types, Elon Musk, were to put $100 million in a fund, trust fund, and we just took the interest off that to help people get the surgery, then we would be able to treat, I don't even know how many thousands a year just off that money probably, okay? So anyway, there's solutions out there. I just don't have them. I'm just one little, we have a 20,000 square foot building. The whole Duke Spine Institute does all of our broadcast education out of it. We have, 70 employees here, but I'm not a huge company like the Mayo Clinic or the hospital systems we talked about earlier. We don't have the money to do this. So we need somebody to recognize the value and benefit to society and start contributing with money. So that's what I would recommend to you people. Go out there and find somebody, and let's set up a foundation in their name to help people get this type of new advanced surgery. All right, we're done. We did 2 discs, L3-4, L4-5. They were herniated on the right side. Sorry we couldn't show you the MRI. The MRI was in another facility, and we didn't pull it over to our PAC system today, and that's why we couldn't show you a picture during the surgery. So we will next time. But she had what most doctors, radiologists would call bulging disc or herniated disc. It's the same thing, small herniation. And her pain is mostly from inflammation. All right, let's show the audience the size of the incision. You got a nice tattoo of a dragon. And then, you guys see that? 7 millimeters.
Yes,
tiny.
we do.
Where's the ruler? We'll show you guys the ruler. And there was no bleeding. You guys saw that. We lost like 10 drops of blood. So half a cc. But here's the incision. Okay. There's inches. There's metric. So it's around, it's about a centimeter today. I was a little heavy-handed. That's it. Okay. And she's going to go home in literally 45 minutes. This is outpatient surgery, folks. Fusion is not outpatient usually. We do it outpatient here at Duke Spine. But everywhere else, they admit you to the hospital. And you're going to be in pain for a long time. Because that fusion surgery is damaging and dangerous. It hurts people. All right. Type up your questions for me. I'm going to head over to the conference room. I'll answer your questions face to face. Fire away. I'm not afraid to take any question. Don't feel shy or bashful. As long as it's related to the spine, I'm happy to do it. All right, and let's go ahead and show them a nice testimonial of somebody we just did. I'm Dr. Duke Majan. I'm here with one of my patients and friends who I've known for years, and she has been suffering with back pain for, well, I'll let her tell you how long. And a week ago, she came and had the Duke laser disc repair. She's here for a checkup, and I'll let her tell you how she's doing as well. So how long have you had your back pain for?
Started back in May last year, and I just couldn't get any relief from anyone. Finally, I asked you, and the rest is history. So this last week has been the best week of my life since May of 2022. So pain-free.
Excellent.
Yeah.
Now, I know it got bad last year, but did you have back pain on and off before that?
I did. I actually got thrown from a horse back in 2018 in Ireland. And that's what I think probably started it. I was having lower back pain, but never really did anything about it, just sort of lived with it.
Kind of modified your life, took
Yep.
it easy, try to avoid things that aggravated the pain.
Exactly.
And now I know that you were suffering so badly before the surgery, and here you are with a smile on your face.
Oh yeah,
Yeah.
definitely.
Well, I'm so happy you're out of pain. You had the Duke laser disc repair. You could actually see, we use a laser to clean the tear in the back of the disc where the pain comes from. The problem is most doctors don't know that's where the pain comes from, so they have no idea how to fix it. My years of doing endoscopic surgery taught me that that's exactly where the pain comes from. So it's a small little spot in the back of the disc. You fix that, the back pain goes away.
And it worked.
It's amazing.
It's like I told your wife, you're a miracle worker.
Oh, thank you very much. Is there anything you want to say to your fans out there?
I just highly recommend if you've had back pain in the past, don't live with it anymore. Call Dr. Duke. He is the best.
Yeah, so many people's lives are just, quality of life is ruined by back pain.
It is, and not worth it. I'm ready to start traveling again, so.
Not too much too soon.
Not too soon, I know.
All right, very good, Jean. Great to see you.
Alrighty, thank you so much.
You're welcome.
I appreciate it.
See you.
You too.
And I'm Dr. R. Dugmajian here at the Duke Spine Institute. I'm smiling because I'm sitting with my first surgical patient of 2023. I don't know if you realize that, but you were the first one of this year,
Okay.
of the new year. Now, you had the Duke laser disc repair done on your lower back because you had 3 bad discs, and we did that yesterday.
Yesterday, yes.
And here you are, one day later. How do you feel?
And I feel good. I feel good, and the pain that I've been suffering for months is gone. I mean, I'm a little bit sore, but that's from the surgery itself.
Yeah.
But otherwise, I feel good. Feel good.
Now, you've had back pain too, on and off for 30 years. We were talking about that. Tell us about those episodes of back pain. What do they do to you?
The first one that I recall was pulling out a sofa bed thing. And I got so far with it, you know, we had company and I was opening up the bed and all of a sudden I just could not move. I couldn't move. My husband had to practically carry me. So I was out of work for a week or so and then at the chiropractor and then gradually it got better and I thought, well, that's fine. And I moved on and then, you know, had a couple other times like that. One time I was drying my hair, getting ready for work with the blow dryer going like this with my hair and all of a sudden it's like I couldn't move. I couldn't move my arm down. I couldn't, I mean, it was that quick.
Yeah.
And just, I was out again for another week, laying in the bed and doing all that stuff. And then I thought I was fine, but I always, not always, but for many years now, probably at least those 30, I had lower back pain, where in the morning I couldn't bend over to brush my teeth. You know, that would really hurt.
Yes.
So I had that.
Do you have that pain now?
No, I don't think so.
It's gone.
The pain this morning, I was the first time in a long time I've gotten up first thing in the morning and was able to walk and not have that awful pain, because first thing in the mornings was the toughest.
I'm so happy for you. So how is this surgery going to help you in your life?
Well, hopefully I can, once I can at least walk again. I was not able to barely walk with a walker. I was very active in my church, in my community.
So you want to get active again?
And being in such pain now since July, and this is the new year, I'm anxious to get back to, you know, my life.
Yes, of course. Well, you had 3 herniated discs in your lower back, and you can see in the footage where we went into each of those 3 discs, and I used a laser to clean the tear, where you had a tear in the back of each of those discs called an annular tear, and the jelly from the center was stuck in the tear, holding it open, allowing more herniations to come out. So I got rid of the jelly that was in there using the laser, cleaned out the tear, and now your body will be able to heal that for the first time in 30 years. So I don't expect you to ever have that pain ever again.
Thank you.
You're welcome.
I am so thankful.
Well, you had faith
I
and
am.
you found us.
Yes, I
and
did.
You did what's right for your body, and I'm excited for you. So
I believe I did. I just kind of was led to you, and it just all went bing, bang, boom, and I didn't ask a whole lot of other people what they thought. I just did what I thought was I needed to do
good.
for me.
Is there anything you want to say to your fans out there?
I would recommend that if you do something to your back, that you take care of it early on. You take care of it right away. The longer you wait, the harder it is and the longer it takes.
It takes a toll on your life.
Oh, definitely. It has taken a toll on mine since this summer, for sure, where I have not been able to, sometimes not function at all, barely be able to sit in a chair and be comfortable without squirming because I couldn't find that exact place where I didn't have pain. You know?
I don't see you squirming anymore.
No, I'm not squirming. I know. That's great. Sit here without pain.
Congratulations.
Thanks to you.
All right, have a blessed day.
Thank you. You do as well.
And good morning, I'm Dr. Dugmajian. I'm here with one of my lovely patients from Canada who's visited us because her back has been hurting for 7 years. She's had a herniated disc that she's been kind of monitoring at L5-S1. And finally, it really started bothering her a lot over the last 7 months to a year, causing pain down into her right leg. So she decided to do something about it, and she went to see her doctor in Canada, who then said, yeah, I'll have you see the specialist in 3.5 years. Well, that wasn't going to work for you, right?
No.
Yeah, because you don't want to live in pain for 3.5 more years. And even then, you don't know what you're going to be offered. But she found the Duke Spine Institute and learned about the Duke laser disc repair endoscopic surgery. And you had it done yesterday.
Yes, yeah.
How are you doing?
I'm feeling great today. I have no pain in my back. I have some tight muscles from me having to walk very oddly for quite a while due to the sciatic pain. I must say, this is the happiest I've been in a very long time to be able to stand up straight and go for a walk. Because I'm an active person as is. I ride horses for a living, so having to be locked up in my room for the past while has not been good. So this has felt amazing, amazing.
So you're happy with the results?
Very. I feel very hopeful also to be able to do what I want to for the rest of my life.
Yeah, after we let the disc heal, right?
Yes, full year of nothing, and then we can.
Yeah, I wouldn't say nothing, but you know, horseback riding, it's one of those things where I love horses and I love riding horses. I'm not very good at it, but I'm one of those people you see bouncing up and down, up in the saddle. So I know that it can be rough on your back, and I just want to make sure you give your back a full year to heal. So you can see in your surgery right here, we actually tested your L5-S1 disc with a discogram, which is a test done to verify that that disc is indeed causing your back pain. And when we tested it, you said, and we asked you how bad it was. You said 10 out of 10 pain. And I said, is that your typical pain you get every day? And you said, yes, it is. So we verified the source of your pain was the L5-S1, and you can see the laser was used to clean the tear endoscopically. Your incision was only 1/4 inch, and there's no need for fusion or metal or artificial discs. This surgery replaces fusion and artificial discs. What are you going to do now that you're feeling better?
Well, it's, again, don't worry, I will take it easy, I promise. But no, I'm going to be, after this, this year, I hope to be the strongest I've ever been, and I have very high hopes and whatnot. My dream is to make actually the Canadian Olympic team for my sport, and that's end goal, and I feel like it's a possibility now.
Absolutely.
To do it.
You can.
Yeah.
We're rooting for you. And I know you have an incredibly supportive husband who's been by your side the whole time. He's a delightful young man, and I've had time to talk to him as well. So you're lucky you have support from your family to help you get through this.
Yeah.
Anything you want to say to your fans out there?
Oh, geez, I don't even know where to start other than just this place really can offer you really what either you deserve or what you need going forward to be able to live a happy and good life. And it's amazing to me that literally it was yesterday I woke up from it and I went for a short walk like immediately, and I felt amazing. So it's it's very hopeful, and if you are suffering from any of it, don't wait, especially for the Canadian system. Come and do this. It's worth it. It's really worth it.
Awesome. And I'm going to be, and my whole team is going to be watching the equestrian sports in the Olympics, looking to see for you to be there.
Yes.
All right.
Awesome.
And
Amazing.
of course, supporting you.
Thank you. Yeah.
All right. Congratulations.
Thank you.
All right. Take care. Okay, Dr. Dugmajian here. I was just in the operating room talking to you and performing the surgery on this young lady. And just so you all understand what we did today during the surgery, this patient had some herniated discs that were causing her back pain and right leg pain. But what is a herniated disc? Well, let's take a look here. Forget about the screws and rods for a moment and just focus on this white structure right here. This is the disc. Okay, you've got 5 discs in your lower back. The most common disc to cause back pain is the L4-5. After that, it's the L5-S1. After that, it's the L3-4, then the L2-3, then the L1-2. I almost never see L1-2 be a problem. So probably by far the most common is L4-5, L5-S1, L3-4. We see those all the time. And in her case, it was not the L5-S1, but actually the L4-5, L3-4. And her herniation was out there in the foramen. There was a tear in the wall of the disc, and the jelly from the center was sticking out. You could see it as the red thing. So instead of the traditional laminectomy, making a cut in the back, going through here, removing all the bones and ligaments, and then, trying to reach around the nerve root and get to the herniation. We actually went transforaminal, meaning we came off the side and we went in with an endoscope and found the tear in the herniation, used a laser to clean everything up, remove it, and her back pain is going to be gone for the rest of her life from those 2 discs, as long as she doesn't re-injure them. Also, her leg pain will be gone. So this will be a very successful outcome for her. I have no doubt about it. We lost basically 10 drops of blood, very little blood, and we call that half a cc or half a milliliter. Open back surgery, you're going to be losing 100 cc's. We lost half of 1. So even if you said we lost 1, we lost 1% of the normal blood loss for open back surgery, just a laminectomy alone. And that's on a good day. Many surgeons lose 200 cc's of blood, 300, 400, 500 cc's. Once you get to 500 cc's, you're just over 10% of the blood volume in a typical patient. Normally it's going to be around 4 to 5 liters, 4.5 liters. So a liter is 1,000 cc's. So most people have around 4,500 cc's or milliliters. cc and milliliter is the same thing. cc is a cubic centimeter, milliliter is another measure, but they equal each other. Okay, it's a volume. So most humans have, let's just keep it easy, 5,000 milliliters of blood. Most surgeons doing spine surgery are going to lose 500 or 10% of the blood volume. If you lose 10% of someone's blood, you don't have to replace it. If you have a normal amount of blood and hemoglobin in your blood, if you lose 10%, you're fine. When you lose 20%, then you start to become really symptomatic, and your heart starts racing, your blood pressure drops, etc., etc. Bad things happen. Point I'm trying to make is, why lose 500 cc's when you can lose 1 with this surgery? Okay. The other thing to think about is open back surgeries like laminectomy, discectomy, they cause scar tissue. What causes a scar tissue? Inflammation and destruction. What's being destroyed? Your normal muscles being destroyed, your ligaments are being destroyed, your bones are being destroyed because the surgeon's ripping that stuff out. Well, how do you know that? You don't see it. Of course you don't see it. They don't show you the video of their surgery because they don't want you to see it. If people saw what was going on in those surgeries, they would literally faint. And instead of, 10% of people going and having the surgery done, only 1% would have it done. They'd be too scared. It'd be like what? Literally, you watch a horror movie and you watch Jason attack somebody and stick them with a knife or a pitchfork and gash them up. They're bleeding everywhere. That's literally nothing compared to the horror of open back surgery. If you go watch one of my videos on YouTube, just go to the playlist under Duke Spine, go down to like lumbar fusion live streams, which we've done hundreds of them over the years, and just watch all the bleeding and meat and potatoes going on in those surgeries. That's why you have scar tissue. That's why you have muscle damage. It's unavoidable with open back surgery. With the Duke laser disc repair, there's no damage. There's no bleeding, no muscle damage, no scar tissue. It is beautiful, perfect spine surgery, as good as a human being can do. And most importantly, the results speak for themselves. We cure people's back pain every single day we do these surgeries, every time. Right now, some people have facet pain or SI pain or piriformis, other parts that cause pain. We have to go fix those afterwards. This next surgery coming up, she's from Canada. We've started operating on Canadians again. For a while we stopped. We met our quota. I'm just kidding. We have a lot of Canadians that come here for surgery because they can't get good surgery in Canada. We have a lot of Americans that come here for surgery because we can't get good surgery in America either, except for here at Duke Spine. Long story short, she's got a herniated disc at L5-S1. She's got a herniated disc at L2-3. We're going to be doing the Duke laser disc repair, right approach 2351. Yesterday she came from Canada and she started talking to me, and I'm examining her, putting my hands on her, and I'm mashing around that facet joint at L2-3. Turns out she has facet joint pain. How do I know? Well, first of all, the pain was off to the right side and the facet joint was tender when I was pushing on her skin right over it. I said, I think you have facet joint pain on top of the disc pain. So we said, let's go do a diagnostic MBB. So we took some Novocaine and we basically numbed up that L2-3 facet joint. Guess what happened? That pain right there went away 100%. So immediately, by numbing the facet joint, I knew the facet joint was the cause of the pain that she was having to that right side, because the pain went away with the diagnostic block. So now we're adding on a Duke plasma rhizotomy to treat the facet joint pain at L2-3 during the surgery. So this surgery, the next one coming up, will be a Duke laser disc repair to fix 2 herniated discs, L2-3-L5S1, and a Duke plasma rhizotomy right side L2-3 to fix the facet joint pain. Okay? And that will be starting in about 30 minutes. All right, we have any questions?
Yes. Before that, we do have a few comments. This first one comes from Sharaf on YouTube, and they said, when we were talking about the insurances, laminectomies, and fusions, he added, plus they didn't tell you the truth of what happens after fusion. Had C5 through 6 after 2 years, and got adjacent segment disease at C4, 5, C6 through 7.
Yeah.
Each time I asked my doctor, he said everything he saw was good and fused.
Yeah.
But Dr. Duke told me the truth about after my MRI review and CT scan.
Hi, Shiraz. Yeah, so what Shiraz is talking about is he had a fusion done, and I think he had a little bit different hardware, but I don't remember exactly. Long story short, folks, anytime you're putting metal in your spine to hold the bones and fuse them, that is not the way God meant for your spine to be. You were born with a mobile spine. Mobile. Moving. The bones move. They're supposed to move. All right? And the reason they're supposed to move is so you can move your neck. You're supposed to look around left to right. You're supposed to go look down and look up. And these movements of the spine are facilitated or made able to happen because of the discs and the facet joints in the back. You can see them moving, all right? Facet joints like right there. So our spines were designed to be mobile so we can be functional. We can look around our environment and do things. And people are extremely active today, so they need their spines mobile. Fusion takes away the mobility. Artificial discs eventually take away the mobility because they end up fusing and they don't end up staying mobile. Now, people may disagree with that opinion, and that's fine, but that is God's honest truth. That's why we don't do artificial discs here at Duke Spine, because they are not as billed. They do not provide the benefits that they promise to provide you. The studies they've done, I've seen them, I've studied their studies. They are, I just have to choose the right word here, they're basically fake results, okay? Fake results. And yes, I'm saying that, they're fake results. Yes, they've been peer-reviewed and published, but that's just a testament to how corrupt our peer-review publication system is. It is corrupt. It is massively corrupt for many reasons. So, I don't believe in artificial discs. I hate them. I think they're unnecessary. They're horrible. They hurt people. I also have now come to realize that fusion, which was honestly my go-to procedure to fix people's spines for many years, and I do great fusions, really nicely done fusions, outpatient. People go home the same day. There's no morphine pumps, no hospital, no bleeding, no complications. My fusion patients do great. Yet, compared to the laser surgery, the fusions are barbaric. They're like dropping a nuclear bomb on a country to win it. You don't do it that way. The laser surgery is political. We go in, we make a deal, everybody's happy, we take over the country, if there is such a thing, right? But it's done without bloodshed. Whereas fusions are like nuking a country to take it over. You've destroyed everything in there. Why do you want to take it over anymore? Look at Russia destroying the Ukraine. Really stupid. I'm sure Russia could have worked something else out with Ukraine to benefit everybody. Anyway, long story short, the days of destructive spine surgery like fusions, laminectomy, microdisc, they are numbered. You will hear me say this. Nobody else in the world will tell you this because nobody else in the world is as far ahead technologically as we are at Duke Spine. But I will promise you that 30 years from now, there will not be fusions of the spine being done except for rare cases where it's absolutely necessary. And that will be about 95% of the existing fusions that are done in the world and artificial discs will be gone. And instead, everyone will be doing the Duke laser disc repair. I'm so confident of this. I'm not trying to promote myself or market myself. I'm just being honest with you. All right, next question or question.
Before the question, we have a comment from Diver X. When you were telling him the facts, he says, "I do believe I'd like to contact you guys pretty soon."
Sure. So Diver X, we have two types of MRI reviews, since I'm being honest with you guys today, as I always am. But I'm not just being honest, I'm being forthright. There's a difference. So we have two MRI reviews. One's free. It's called mri.dukespine.com. You're welcome to use that. And then we have the MRI review that costs $99. It's dukespine.com/virtual consultation. Now, we created the $99 one basically for pain in the ass people. I'm just going to be honest with you. People that have really complicated histories, a lot of stuff going on, and it's not a simple thing, or the person is legitimately a pain in the ass. And you know, look, I know people need an explanation, and I get it. But there are some people that just take it way too far. They take up all your time. They monopolize your time. You've seen these people out there on social media. You don't like talking to them because they know everything. They're a know-it-all. They know more than a neurosurgeon, and I honestly can't stand those people. However, for $99, I'm willing to stand them for 10 minutes. So, hey, I'm just being honest with you and forthcoming. So there's two options. Feel free to use the free one, the mri.dukespine.com. I've enjoyed our conversation over the internet and happy to help you and most everybody out for free.
And then the next two questions we got, the first one is from Lakeisha on YouTube. And they asked, I've recently had an MRI which shows that my L5-S1 disc is herniated and pressing on nerves. I've had pain in both of my legs. Is surgery necessary? I have tried physio twice and the disc is now worse. My back pain has been an issue for over 2 years now.
Sure, come on in. Hi, Lakeisha, to answer your question, great. Thank you for asking a question. Thank you for being here, broadcast. You have, my understanding, you have a problem with the L5-S1 disc, all right? It's herniated, it's pressing the nerves, you're in pain, and you're trying to not have surgery, right? Well, everybody tries to not have surgery, and I agree with you. That's always, if you can avoid surgery and get better, get well, that's what you do. But my 26 years of doing this, I am 1,000% out of 100% sure you're going to need surgery. Why? Because those disc problems never in my experience does the pain go away 100% to where you can live a normal life without treatment, surgical treatment. So what I'm getting at is you may get lucky and the pain will go away on its own for a few months. But the moment you start getting active again, you're doing things you want to do, golfing, walking, exercising, whatever it is to be active, as soon as you start getting active again, that pain will be back. Why? Because it's arthritis pain. You got a damaged joint. It's just like a bad hip. If you have an arthritic hip, you can take it easy, rest on the couch, watch TV for a few weeks. The pain will get better. But the moment you get out there, you start gardening, you start walking or jogging or biking, that pain's coming back because you're using the joint. It's moving, and there's arthritis in the joint. So the more you move it, the more grinding there is, the more pain you get. It's the same with the lower back and these herniated discs. Here's what I would caution you on. You should, number one, do the consultation with me. Let me make sure you have only one bad disc, because you may have 2 or 3. They're only telling you about the worst one. You'll get that operated on somewhere with a fusion or artificial disc, whatever they do, whatever they convince you to do. And then you'll be back again a year later because the next one above, the L4-5, was also bad. So what I'm telling you is the reads and the reports that you get on your MRI are wrong about 90% of the time. That's what I've found over the years. The reports are wrong 90% of the time. And you want to avoid having to have 2 surgeries. You really want to get everything fixed in one. That way you don't come back with adjacent segment disease. So my advice is take advantage of our free MRI review, find out the diagnosis. Is it just L5S1 or is it L4-5, L5S1? Whatever. I'll tell you what it is after I examine you virtually on Zoom and I look at your MRI at the same time. I can tell you where pain's coming from. Do that for yourself and then decide if you want to get your back fixed. But you will not get that pain going away without surgery. But you have to have the right surgery.
And lastly, we have a question from Oz that asks, can you do laser surgery if you have listhesis or pars defect?
So Oz, you're asking, can we do the laser surgery successfully? Of course. I can do the laser surgery, but can you do it successfully and get rid of my symptoms if I have a pars defect and listhesis? The answer is 100% yes. We do it all the time. We have so many people come here with spondylolisthesis, a slippage of the bones, and we do the laser surgery. Their pain goes away in their back, their legs, 100%. And we don't do any fusion. So you do not need to have that fused. Come to Duke Spine and get the laser done.
And that is it.
We'll see you all shortly. We have more surgery in about 20 minutes, 30 minutes. We'll be broadcasting our